everyone, welcome back to my YouTube channel, Nursing with Beatrice. In today's video, we'll be looking at dose calculation part 2. So I have done a video on part 1, that was on oral medication. If you have not watched it, please try and check it out. So let's begin. So dose calculation, this one I'll be looking at on subcutaneous medication, intramuscular and intravenous medication. So some things to consider: you want to determine the form of the medication, you want to determine the route. So for the route, is that subcutaneous, is it intramuscular, is it intravenous? You want to know the frequency, how often you should give the medication, the conversion. You want to determine if you need to convert from one unit to another before you even solve your question. And then you want to take note of the order dose versus the available dose. And most importantly, after you are done with your calculation, you want to review your work because you could make mistake without knowing. So let's look at example 1. The order says 2,500 units of heparin, subcutaneous, Q 12 hours. Supply is 10,000 units heparin. Question A says, how many ml will you administer with each dose? And question B says, how many ml will you give in 24 hours? So now we're going to look at the route of medication. We know is subcutaneous, frequency is every 12 hours. Do we need to convert? Is in units, so they are in the same unit, so we don't need to do any conversion. So we'll go ahead and do our calculation. Now for the calculation, the formula we usually use is amount to give is equals to the ordered dose or the desired dose divided by the available dose or pharmacy supply multiplied by quantity. Please don't neglect this quantity because you'll be needing it in some of the questions. So let's see the order dose. So here the order dose says 2,500 units. The available is 10,000 units, which is the supply. The quantity will remain as 1. So if we do this calculation, so the amount to give, this will cross out, this will cross out, this will be 0.25 ml. Remember to put the units. So this one, what's the frequency? We have to give this every 12 hours. So the first question that says how many ml will you administer with each dose is saying how many ml will you give every 12 hours. So this will be Q 12 hours. So that's the answer for A. Q 12 hours. So let's look at question B, which says, how many ml will you give in 24 hours? So in 24 hours, how many do we have in 24 hours? If we are giving every 12 hours, that's times 2. So that means we'll be multiplying this by 2. So it means 0.25 multiplied by 2. That will give us 0.5 ml in 4 hours. Order heparin 7,500 units subcut daily. The supply is heparin 10,000 units per meal. The question is how many ml will you administer? So you try this. If you did your calculation correctly, the answer will be 0.75 ml. That's what you will give. So let's look at example 2. Order Demerol 65 mg intramuscular daily, and the supply is Demerol 75 mg per ml. How many ml will you give? So let's solve this again. First, we'll send the order, we'll send the supply. It's through intramuscular route. The frequency is daily. And do we need to do any conversion? This is a milligram, this is a milligram, so we're not doing any conversion. So let's do our calculation straight away. So we know that again the amount, order dose, over available times the quantity. So the other dose is 65 milligram. The available is 75 milligram. The quantity says per meal, so per 1 meal, 1. 65 divided by 75, so the amount will be, if you do the division, you get 0.86666, so that's approximately 0.9 mil. So that will be the amount to give on a daily basis. So now you try this. Order 30 milligram of the medication intramuscular daily, and the concentration, which is also the strength or the supply or the available, is 50 milligram per meal. What amount will you give? So if you did your calculation right, the answer will be 0.6 mil. So let's look at the last example. Order 4 grams of that particular medication intravenous daily. Supply is 1,500 milligram per 2 mil. How many mil will you administer? So quickly, let's look at what to consider. So the particular medication you are to give, the order is 4 grams. The route is intravenous, that's through the vein, and is to be given daily. The supply is 1,500 milligram in 2 mil. Do we need to do any conversion? So this one is in gram, this is in milligram. So sure, we'll do conversion. So we'll do conversion first. Now we're converting gram to milligram. We know that 1,000 milligram will give us 1 gram. And this question is 4 grams. So what I usually do, I use this proportion or ratio method. So I'll put the 4 grams here, like arrange it the same line. So meaning we're looking for the particular one in milligrams. So we'll say X milligram. And then we'll do a cross multiplication. So if we cross multiply, so X milligram times 1 gram equals 1,000 milligram times 4 gram. So S 4,000 milligram. So meaning anywhere we see 4 gram now, we'll replace with 4,000 milligram. So let's put it into this formula, which is the amount to give ordered or desired over supply or available times the quantity. So the order now is no longer 4 grams, it's now 4,000 milligram. The available is 1,500 milligram. And the quantity is 2. So if we do this, this will give us 4,000 milligram will cancel. 4,000 times 2 will give us 8,000. Divided by 1,500. This will give us 5.3 mil. So this is the amount we'll give. So this is for you to try. Order gentamicin 90 milligram IV Q8 hours. Supply gentamicin 40 milligram per 2 mil. The question is number 1, how many mil will you give per dose? And the second question is, how many mil will you give in 24 hours? So I'll give you time to try this. You can pause and do it. So if you did your calculation correctly, for A, you will get 4.5 mil. Now for B, it says how many mil will you give in 24 hours? 24 hours will have 8 as the frequency. So if you divide it, you will be getting 3. 8 divided by 24 is 3. So you multiply this by 3. So that will give you 13.5 mil. So this is Q 8 hours. So that wraps us today's topic on dose calculation part 2. In another video, I'll be doing weight-based calculations. So you want to keep an eye out for that. If you enjoyed this video, please like, share, and subscribe for more educational content. Thanks for watching.